Hey, it's Dr. Troy here, Zenaptic Chiropractic. Been in Vancouver over 22 years serving patients. So I want to talk about how do you get out of pain fast? What kind of pain? Spinal pain, back pain, neck pain. These things we see rapidly improve with the techniques that we use in our office. So a lot of patients, I had one guy recently, he spent 20 years going to different doctors, trying different medications, injections, therapies. Nothing was working for him. He came to us and within 8 weeks got 90% improvement in his function. And so how do we measure that? Well, we use a form, it's called a quad visual analog scale. It actually helps to measure when's your pain at its worst, when's it at its best, what's the average pain, and what is it right now? And then we take that score and we calculate it and then we say, here's your number. It's on a scale of 1 to 100. So let's say you're an 80. And so we would say, hey, your goal for the first 4 weeks of care would be maybe to reduce that 50%. You know, I always underestimate. I just had a guy, he was an 80, and I said, hey, let's get you to 60 in 4 weeks and see where we're at. He went to a 12. So in 4 weeks, he went from an 80 out of 100 down to a 12. And he's functioning, he's moving. This guy's older, and he's never taken care of himself. So I went, wow, that's pretty amazing that he got some fast results. And then there's some, I had a lady who, her migraines, just after a fall, she continued having more and more migraines. So we sent her to a neurologist to have her checked out, make sure there was something in her brain that's not being disconnected. Because most people are going to respond very quickly. They're going to respond very good. Adjustments feel good. A couple things we do in our office, we do traction. Traction is going to help, especially in the neck. It's going to help restore the curve. It's going to help open the disc. It's going to help the ligaments. It's going to get blood flow. It's going to relax the muscles. And then we use therapeutic exercises on a wobble board type chair where we do certain exercises to strengthen the low back, to help hydrate the disc, take the pressure off the nerves, relax the muscles. And then I use very specific chiropractic techniques to do what? To help improve joint segment mobility, to help clear out the edema, the swelling, the stuff that makes you hurt all the time, to get the nerve system flowing. And then we've got some home care stuff you can do. And the patients who follow the frequency of what we recommend and do their home care and take some psyllium and do some of the stretches we tell them to do and the icing, those are the ones that get the best results. And so I always encourage patients, follow the recommendations, let us be your doctor, you be the patient. A lot of times I have patients think they're the doctor, they think they know what they need, and they struggle with getting the best results. And so we always like to measure the outcome, show you the improvement so that you're a happy patient, you'll send us patients, and that we get a healthier community to live around. So if you're interested in coming in, Dr. Troy, free consultation, come see us, 360-260-6903.